main job of the heart is to pump oxygenated blood with nutrients through the arteries and then receive back deoxygenated blood full of waste products through the veins. Now let's zoom into the left ventricle. There's a moment fully relaxed, and it occurs at the end of filling, or diastolic point. And the volume of blood within the left ventricle is called the end, and it's about 120 millilitres. Then, forcing blood through the aorta and into the whole arterial system. After that is another moment when the left ventricle is fully contracted. It's at the end of contraction, or systole, also called the end systolic point. And the volume of blood is called the end systolic volume, and it's about 50 millilitres. So, end diastolic volume minus end systolic volume, which is the volume of blood that the left ventricle ejects with every heartbeat. In this case, the stroke volume is 120 minus 50, which equals 70 millilitres. Stroke volume is a useful measurement, but it can vary based on the size. For example, a stroke volume of 50 millilitres might be absolutely fine for a small person, but maybe low for a large person with a bigger heart volume. So another helpful measurement, which is the stroke volume divided by the end diastolic volume. In a normal individual, that's 70 divided by 120, or about 58%. Fluctuate between 50 and 65% and still be considered normal. In other words, at least half of the blood volume in the left ventricle should get pumped out during each heartbeat. In hearts that have a low contractility, or a low force of contraction, can fall below 50%. Every minute, though, our heart beats many times. The exact number of beats per minute is known, and if we multiply the stroke volume times the heart rate, we'll get, which is the total volume of blood that the left ventricle ejects in one. Using the stroke volume and a resting heart rate of 70 beats a minute, cardiac output is 4,900 or 4.9 litres per minute. Now remember that a normal approximately 5 litres of blood. So this means that every last drop of blood travels at least once every minute. Of course, the heart can adjust its based on whether you're sleeping or exercising. In fact, it can have a cardiac output that reaches up to 35 litres per minute. That flows through the arteries and is distributed to the various organs and tissues to meet their oxygen and nutrient demand. Of all the organs, the liver receives the largest amount of blood flow. The kidneys also get a lot of blood flow, but less than the liver. However, when tissues, the kidney gets much more blood per gram of tissue than, and this is called tissue perfusion. So, blood flow refers to the total amount of blood volume over time, and perfusion refers to the total amount of blood volume going to 1 gram of tissue. Alright, so as a quick recap, stroke volume by the left ventricle in a single heartbeat. The ejection fraction is the percentage of blood that's pumped out of the left ventricle, and this can serve as a measure of the heart's contractility. And finally is the volume of blood pumped out of the heart in 1 minute.